today ankle injuries and the acute care in the instance where you would perhaps roll an ankle if you were to step off a curb, or perhaps have a soccer injury, something like that. This is an ankle model, so we're looking at the right ankle. On the outside we have the ligament complex. We have the most commonly injured ligament comes from the outside here. It's called the anterior talofibular ligament. It comes from an injury where you would roll over onto the outside of the ankle. The symptoms that you would feel immediately, you often hear a crack, the ankle swells up straight away, and you may or may not see that it bruises straight away as you have some damage to the capillaries, the surface capillaries. So really what you're going to have is a hot, swollen ankle that obviously it's going to be painful to weight bear on. So the immediate treatment for that is what used to be called RICE, so rest, ice, compression, elevation. Well, that still stands, so it must be age-old and it still works. So rest is the first one. You need to stay off it. Okay, all of these structures that have been stretched and injured need to be, you need to avoid excess injury on them or excess stress on the joints while they're healing. So for the first 3 to 4 days, you really need to avoid too much weight bearing. You don't want to be walking around. You just need to be doing non-weight bearing exercises. Second part of the RICE protocol is ice. Okay, so you literally need a blue gel pack that you can buy from any pharmacy, out of the freezer, a packet of frozen peas if you don't have one of those available. Put it directly over the injury site, so you're going to put it on the ankle. Probably put a tissue, a Kleenex, something over it first so you don't have the ice immediately on the skin, because with ice there is a risk of an ice burn if you leave it on for too long and it contacts the skin. So you need to just be aware of that, but directly applied to the skin with a small thin membrane underneath it. Ice for about 20 minutes, and you should be doing that in the initial stages every 4 to 6 hours as your schedule allows. Third part, and for me is the most important, is compression. And most people don't do this, they just do the ice component. But what you're going to notice, as I said initially, is that in the injury the ankle is going to swell almost immediately. So you need to get that compression on, because with the amount of fluid that's going to be surrounding the injury, it's going to actually hinder the body's healing abilities. All right, so you need to get that swelling out of there straight away, and that's going to make your physical therapist's job a little bit easier once you finally come to see us, because there isn't going to be the edema and the swelling in the area, and your body can heal much better from that. Next one, E, is elevation. All right, so stick your leg up in the air, a couple of pillows if you want to sit on the sofa and just have the foot elevated. Then that's going to help the body's natural pump with the assistance of gravity to get all of that fluid out of the foot. Worst thing you can do is be sitting down or having it hanging down in what we call a dependent position, where the foot is down, because that swelling is going to go straight to that swollen area where the blood flow is already increased because of the healing process. So rest, ice, compression, elevation. Once you've done those and you stick to that for the first 4 to 5 days following injury, then your healing is going to be much more efficient, and it'll make the physical therapist's job a lot easier.